Hi, my name's Gavin Francis. I'm a doctor and a writer and the author of The Unfragile Mind, Making Sense of Mental Health. Of the millions of GP appointments that take place each year in this country, about a third of them are concerned with mental health. And during the pandemic, it was near to half of my consultations that involved mental health problems. I wanted to write a book that would show what can be done to help and the kinds of things my patients have taught me over the years about how they've best learned to manage their own mental health issues. Between a quarter and a fifth of young people in the UK today suffer from a mental disorder by the criteria used by psychiatrists, and over a half of them say that they've suffered a mental disorder at some point or another. 1 in 4 adults today are being prescribed psychiatric medication. And this represents a huge recent shift, a big change in our society. And in the book, I make a call for greater humility and curiosity, kindness, and hope in how we think and talk about this change in mental health. I explore a couple of thousand years of Western ideas about the mind, showing that the ways we think about thinking and feeling and even being have always been in flux. And I examine some of the main problems people come to see me about in clinic, such as anxiety, trauma, depression and low mood, bipolar illness, addiction, their struggles with neurodiversity. It's about the whole framework of the way we think about the mind and about mental ill health. Mental health is inextricably cultural. Do you know, our mind is built as much out of the relationships of care and trust and love in which we grew up as it's built out of chemicals and brain cells and neurons. And so different cultures have very different perspectives on what constitutes mental health and ill health. In East and South Asia, for example, there are syndromes of anxiety that we don't even have names for in the West, but those syndromes are very powerfully real for the people who suffer them. There are many cultures, for example, where you say that a depression is on you rather than in you, which can sometimes make it easier to shrug it off when the time comes. There are also cultures which focus all of anxiety into bodily sensations, and so they're described as being within the heart or within the breathing or within the chest. And if you were to explain to somebody of that culture that in the West we think of anxiety as a problem of the mind, they would think that you were making no sense at all. So your culture inextricably builds the world in which you live, and that builds the world in which you perceive mental health and ill health. Well, there's no doubt that statistics in recent years have shown a huge increase in the prevalence or in the diagnosis rates of all sorts of mental health problems. It's actually quite difficult to compare those rates with previous generations because the criteria that we're using to count these kinds of problems are changing all the time. Over the last few years, we've also really widened the criteria for what counts as a mental illness or a mental disorder, and we've also lowered the bar towards diagnoses. But even when you take those things into account, there does seem to have been an increase in reporting of mental ill health. There's a variety of theories out there as to why that might be. For some people at one side, this has been a welcome, long overdue recognition of just how severe some people's mental health problems are. For other people, we as a society would say that we're becoming softer, we're becoming less tolerant of the difficult and the hard things in life. And yet there's yet another view out there that would say that society itself is making us more ill, that society is hyper-competitive, hyper-social, and people who don't fit into that kind of society are finding it difficult to go on and are labeling themselves with a disorder rather than feeling that the problem is outside themselves and the society that they're living in. Now, as a GP, I don't really have the luxury of choosing a side in any of these debates. Whatever the patient before me comes to the clinic with as their ideas about their own problems, my job remains the same, which is to try and find the best way to ease their suffering with the ideas that they have already. I wanted the book to be able to touch on some of the mental health problems that I've had over the years, in particular with anxiety, with low mood, with insomnia, and even with some of the traits that sometimes get characterized as neurodiverse. And it was important for me to explore those in the book and show that my learning and making sense of mental health over the years has been informed by my own issues as much as it's been informed by the patients that I've got to know over the years in clinic. Another thing that I wanted the book to touch on was some of the more positive feelings of mind, of mental well-being. So things like contentment, even elation, excitement, pleasure, how sometimes those things can tip over into the darker territory of mania and agitation. So the book tries to make sense of mental health through a broad view, not just with personal experience, with my broad reading in the fields of psychology and psychiatry, but also with what patients have taught me over the years. Robert Burton's The Anatomy of Melancholy is an extraordinary 900-odd page polythesis of exploration about the nature of low mood and depression and melancholia, written now over 400 years ago. And it's really, for me, it's a very powerful, valuable book because it shows that right from the beginning of the modern era, people have been thinking about and exploring about these issues. And it's full of really wise, practical advice about how to manage your own mental health, which is just as relevant today as it was in the 1620s when Burton wrote it. His concluding line to 900 pages of how to manage your mental health is, "Be not solitary, be not idle. Happy ones, be cautious. Unhappy ones, have hope." It's really lovely.